My role, I think, was to bring the connection to academic women's health. So I'm a physician, I'm an internist, actually geriatrics is my specialty, which I like to think of as older women's health. And I'm a professor in the Department of Medicine at the University of Wisconsin-Madison, and I also have appointments in the departments of psychiatry and industrial and systems engineering. And so my role with the Judith Stitt program, I think, was to shine the light on the connection between women leaders in academic health sciences and women's health research and the advancement of women's health. And there's evidence for that across the board. And so women tend to leak out of the academic pipeline at certain vulnerable places, and one big vulnerable place is right at the junior faculty level, the early faculty level, where they have to succeed in getting their research program started, they have to succeed in competing for grant funds to support that research. So perhaps the best way to understand the impact that the Dr. Judith Stitt Junior Faculty Award has had would be to hear from some of the recipients of this award and to understand the impact that this award has had on their professional lives and on supporting research to improve the lives of women in Wisconsin.
The Wisconsin Women's Health Foundation funded me at a critical time in my career, which was very early, when I needed support for a variety of reasons. One is that I needed support for research time, and that was the thing that I needed most at that time when I was so early in my career. I needed time away from clinic so I could perform my research.
The Wisconsin Women's Health Foundation grant really helped in the trajectory of my career. It not only helped me receive funds so that I could then do studies that I normally would never have been able to do, to perform techniques that I never would have been able to afford, but also to hire research assistants. It helped me buy out of research, out of teaching time, and it really helped in my trajectory to now be being promoted to professorial level. When I received the grant, I was an assistant professor. I then was promoted to associate professor and now just recently to professor.
Receiving this award was like a confirmation that I received that the community wants to see this grow, and community sees the potential of my research, that I could, in the end, make this happen and contribute to the community and the scientific field. So that was the greatest benefit I received from getting this award.
You might wonder, well, why do we have to particularly support women at this early career stage? I mean, why are they more disadvantaged, if you will, in terms of being able to compete to launch their research careers? So I study how stereotypes influence individuals' decisions and the evaluation of individuals. And so whether we want to or not, when we look at a woman physician, there's going to be more of an assumption that she'll be a good clinician because she's nurturing, she's about relationships, whereas research is more sort of, a male bastion. And so there's much experimental research to show that in order to be evaluated as being competent, as being able to succeed in one of these sort of male domains like research, women have to provide more evidence. And so the Stitt Award allows those women faculty to provide more evidence. So just at the right time. So it says to the next funding agency that they're applying to, oh, she must be able to succeed at research. After all, she got the Judith Stitt grant. And it also speaks to their own confidence, because assumptions about women succeeding in male domains also affect one's own perceptions of their ability. So getting that Judith Stitt grant also says to the individual recipient, oh, I can do research, I got the Judith Stitt grant. So it really just is at the exact right moment in an academic career, and women absolutely need it more than men at that stage.
There's a real gender bias in the retention and the recruitment of women into medicine and science. And when you have a woman and a man competing for a position, there is a real gender bias against the women from faculty. This has been shown in several studies now, that women are usually hired for less money, they're seen as less able to mentor, they're less hireable, and they're seen and perceived as to be less effective in leadership. And none of those things are absolutely true. And they've done these amazing studies where they've given to faculty in science the same resume, just changed the name, and the women are less likely to be hired and for less money than men. It's a real shame, but it's actually real. So there's a real barrier there for women even to getting hired into these leadership roles.
A lot of women in academic career postpone, having a family, probably as long as they could, and then the time runs out, and they start having babies, and it for me it happened that during my my time as an assistant professor, I had a baby, and that challenge was paramount. It was totally unexpected and very difficult. And it's also probably at that time that I wondered, would I be able to balance my work and family all together? Would I be able to still contribute fully to the work and career and scientific community? But in the end, I learned that I could do both, and actually having a family and having more responsibility helps me, have more, broader impact to the scientific community. I know a lot more about just, humans in general, relationships, and psychology, and the social aspects of humans, and I think that helps me think more about how am I going to direct my research so that I could impact human life in a healthy way.
So often you may be asked to donate to this or that, and you do it because you're a good person, and you may or may not see what your dollars do. And I would say in this Dr. Judith Stitt Award, I encourage you to think about giving. You can see almost immediately what your dollars are doing. You can see the research as it plays out in improving health. You can hear the words of the women themselves and how it's made a difference in their lives and allowed them to progress in their career, so they can teach additional students about women's health, and they can care for patients because they're successful. So I urge you to think about supporting this program.
But it takes significant funding to get off the ground. The $50,000 I received from the Wisconsin Women's Health Foundation supported my time for 2 years to do research as a component of my time. So I still worked in clinic for a significant part of my time, and then had another component where I could do research. And that actually funded my time and not the remainders of my research program, such as other staff. I have graduate students and postdoctoral fellows that work with me as well, and then the support for our actual research.
The person who needs to be supporting this program is anyone who cares about health, in particularly women's health, anyone who cares about science and problem solving, because we know that when both men and women are at the table, that problem solving is enhanced, and there's less women at the table in leadership in medicine and science at the moment. And particularly anyone who has a daughter, anyone who wants to see their daughter thrive in the sciences or medicine and have the same opportunity afforded to their daughter as it could be to their son.
I think a lot of people are not aware of the enormity of the impact that this program has had for the health of women in Wisconsin. So one of the first awards back in 1998 was given to somebody who is now bringing in to the state of Wisconsin millions of dollars from the CDC and the NIH, and the focus of her research is to improve the health of older adults throughout Wisconsin. She is partnering with all of the state area agencies on aging to work in the community to prevent falls in older adults. And of course, most older fallers are women. So when you think that small grant way back in the late 90s is now not only enriching the economy of Wisconsin because these grants pay for a lot of people's salaries, but also improving the health of older women throughout the state. It's just incredible. And that's only one small example.
Having the award, again, really reinforced me that this is the work that I can contribute. Even with having a family, I will still be able to make a good contribution to enhance women's health.
Yeah, some of the pilot data that I was able to establish from the money that was given to me from the Wisconsin Women's Health Foundation then led me to able to pose other questions, other important scientific questions that then led to me receiving awards from the National Institute of Health. And you know, success breeds success. And so receiving these initial awards are just a fantastic way to establish future success and invest in women like myself.
So the Wisconsin Women's Health Foundation grant was really helpful to me because it supported me very early when I had ideas and some early research, but not a fully established program. But another way that it was particularly special to me is that I grew up in Sheboygan, Wisconsin. Both my husband and I are from there. We always knew we wanted to come back here, or at least I did. I always knew that I wanted to come back here at some point. I didn't do all my training in Wisconsin, but when I finished my training, I had the opportunity to come back, and really was my dream to come back to the University of Wisconsin, where I am, raise my family here, and then getting grant support from an organization based in Wisconsin who believed in my work. And I really felt that, and still feel that my work is going to benefit women, and the women that I grew up with and the women that I take care of every day in the place that's my home, that my family lives in, was really special. So it just added an additional component.
Women leaders in academic health science, through their research and through their success, have an enormous impact on women's health. They work to set the nation's research agenda in women's health. They train future generations of health scientists, physicians, pharmacists, and they can only get to that level by being successful in research, and they leak out at this early faculty stage. And that is exactly why we need programs like the Judith Stitt Junior Faculty Scholarship Program. To learn more about this exciting program, I encourage you to visit the Wisconsin Women's Health Foundation website, WWHF.org.